Well, welcome back, everyone, to another episode of the Health Made Simple show. I'm here with our host, Dr. Bart Precourt, who has been a healthcare practitioner for over 20 years, practicing a range of modalities, including chiropractic, acupuncture, kinesiology, functional nutrition and supplementation, and lab testing, all out of his clinic, Balanced Health Studio in Seagrove Beach, Florida, as well as virtually all over the world using Zoom just like this. He's also worked with, he's also the founder of the Health Edge program, which is a cutting edge health program for entrepreneurs and executives wanting to take their health to the next level. So he's worked with celebrities and athletes all around the world. And tonight we get access to him to answer your questions. So feel free to put them in the chat, put them in the comments in Facebook, and I'm going to feed them into him to get his insight tonight.
Yeah, 100%. So, again, just kind of on that theme of some of the current events that are taking place, recently, I had some really good questions, even about like how to manage or how to handle the emotions of, every day seems to be a bigger thing, and that has such a big influence on our health. And my theme will be continuously to, make sure that you're, as an individual, where your line in the sand is, if that makes sense. And I think it's so important, and this has nothing to do with our questions, but so many questions I get, Karen, are wrapped around those different, like, oh my God, this is happening and this is happening. Again, really all about this COVID thing. But knowing where your line in the sand is so important when it comes to health. And I mean that for anything. Like, it could mean like you've gained that 1 extra pound and that's it. You're done. Like, we can't keep like stretching or moving the line. So we got to know when like it's enough. There's enough bullying. There's enough flexing. There's a point for every one of us. And I think this is just an important message I want everyone to hear. There's an important time that we have to draw the line in the sand and know when enough is enough for us as individuals. And does that mean that we have to act out and be mean to other people or rude or any of those things? No, it means we just respectfully can resist. And that could be, your own temptation. So just a little, I think, pre-message before we dive in. That's it.
No, I love it. I think we can all use that reminder every week, because it's very easy, as I've said before, to get caught up in everything that's happening. So no, it's always it's a good way to start, for sure. All right, should we do the first question?
Let's go. Let's dive in.
Okay, Dr. Bart, my son battles me every day to eat breakfast. Then when he does, he will only eat sugary foods. I know he needs something. Any suggestions?
Yes, I have plenty of suggestions. I'm still trying to fix my language. So this is an interesting thing. This I want to tell you, every mom out there knows what's going on right now, meaning that their kids, they battle them. They could be 5 years old, they could be 15 years old. That it is often that young people don't want to eat when they get up. And what's interesting, I'm going to start this off, and I'll give you some insights in this, but we should probably take a step back and listen to this. Every single mom listening to this right now will agree that one of the biggest wrestling matches that they have on a daily basis is getting their son or daughter to eat before school. So what is that saying? It's saying that your body doesn't necessarily need and or want food when we first wake up. So it is okay, and this is going to come by a little bit of a surprise here, that it is okay to let them go to school without food. In fact, it might be beneficial, because what happens here, and this is the most common theme I've seen literally for the last 20 plus years of practicing, is that the wrestling match happens with the child. You can't get them to eat. And just like this person who sent this in, and then all they want to do is eat sugary food. Then what happens? They spike their blood sugar. They're really good for a couple hours, maybe 2 hours or so. And then after that, unfortunately, they crash. And then they're not really good students. Then, Karen, what really happens in these scenarios? They need more sugar. They need more snacks. And that's where like the 10 o'clock thing came. 10 o'clock snack. And then all of a sudden there's a lunchtime. And then there's a snack after lunch. And then there's before dinner, there's another snack. And we're just riding these blood sugar highs. And this is a signal place that we see the tendency, we start to lean toward the ADD and ADHD cases. And listen, this is the advantage I have of practice in all these years, is that I get to observe and I get to look at the cases, say ADD and ADHD. They're very common trait for all of them. They're all sugar addicts. They're all carb addicts.
Yeah.
So when we start putting these pieces together, we're saying, well, what's really taking place? Well, we're forcing the body to eat when it doesn't want to. And then the only thing that'll do is eat sugar. Why is that? Because when the child eats sugar, the young person eats sugar, heck, the adult eats sugar, we get this little dopamine rush. So it's like, all right, I didn't do it, but at least it had a temporary, like that Pop-Tart felt good for a moment. So that's what really takes place. But we also know things like sugar shrinks the brain. Sugar shuts down the immune system. So I know that you would have to go way out on a limb if my moms or dads are listening to me here. Listen, if your kid doesn't want to eat in the morning, send them to school without food. Maybe you figure out how to eat a healthy snack, like a hard-boiled egg, maybe a little beef jerky or something like that as a snack, if they just can't make it to lunch. But maybe starting to do that versus literally knowing that you're putting something into their body that, if this is repeated over and over again, like 5, 6, 7 days a week, that it inevitably will end up in a not so good spot. So the answer there is yes, it is a real issue. And do we have to feed them? No. Sometimes they're better off literally not eating anything. I don't know how well that's going to go because I've never really attempted that for the kids. But from a clinical perspective of thinking about their little bodies, their anatomy, and do little kids have high blood glucose levels? Yes. Do little kids now have prediabetes? Absolutely, positively do. It's sad, it's sickening. Do we have obesity in little kids? We do. Do we have kids that are stuck on sugar and carbs all the time? It's not even their body size, Karen. So it's not even just like you're literally like you look at their habits and all they'll do is eat carbohydrates. So that's a telltale right there. And if that's the direction they're moving into, we know where that road goes.
Yeah, for sure. And I think there are lots of kids that they'll make a fuss, or they only want that type of food, right?
Yeah. And the other, I guess, if I was going to give my parents out there a tip, would be one of the ways you can prepare for the morning and making sure that your child will have the proper nutrients is by making sure the meal at night is good as well.
Oh, yeah.
If that meal before has some good healthy fats, it's very balanced, it's fiber, it has fat and proteins, there's more of you're going to be able to swing that pendulum more in the morning time. You're going to be able to make it through the morning better off. And adding extra sea salt and stuff like that is all the nutrients that the little kids need. And or get them some vitamins or supplements in the morning, or get them some supplements that they can use, maybe a couple hours into the morning.
Yeah, awesome. Well, love it. All right, let's move on to the next question. Is there a certain time in a normal 24-hour day when your blood pressure is the highest?
Is there a normal time in your blood pressure? Well, so things like blood pressure, things like hormones, they all fall in the category of law of supply and demand. So there's not necessarily a time that it should be high or low. Obviously, when you're sleeping, it should regulate lower. We should have a resting heart rate that's lower than normal. So it's one of the reasons I like, like measurables, like your Oura ring and stuff like that. So I measure my blood pressure or my heart rate through the course of the day. The more I do, the more sympathetic activity I'm in, my blood pressure could rise. And then my heart rate should kind of go with it. Your blood pressure, so let me make sure that I can clarify this good. Heart rate goes up. Blood pressure shouldn't necessarily change that much. So although I might be, physically active, like my heart rate might go up to 120, 140, 150, 180, my blood pressure shouldn't necessarily change that much. Although it may vary a little bit, especially the top number, Karen, which is what we call the systolic. That's much more influenced by stress. So you can map your day out and think about any time that you have higher cortisol in your body, there's a more likelihood that there's going to be an influx or a little bit higher systolic pressure. So when we see high cortisol in ideal working body, first thing in the morning, higher cortisol. So that will often throw people off a little bit. Like, I don't understand, my systolic was high in the morning. Well, it could be just because that you have, plenty available cortisol, and that should kind of regulate through the course of the day. But to answer that question in the big picture, you should not see your blood pressure varying that much through the course of the day at all. Heart rate differently. Heart rate will vary, really law of supply and demand. If you're using your body, it should go up. If you're stop using it, it goes down. If you are recognizing, so this is important, if you are recognizing that you are having your blood pressure change, almost always you have an electrolyte imbalance. And the significant ones, they're most likely to be magnesium and potassium. But just a quick reminder, that's magnesium, potassium, chloride, I forget some of the others right now, but anyways, your electrolytes can, if they're out of balance, you can see significant changes in your blood pressure immediately. So it's important that we make sure that those stay balanced. My favorite for that, so Standard Process used to make it in a powdered form, Karen, and I fought this, but now I love it. They made this product called Easy Mag, and it was in a powdered form, and it worked almost like an electrolyte drink. And I loved it because I loved it. Like, it worked perfect for me, and it was a great balancer. When your electrolytes are out of balance, you'll often feel tired, you feel fatigued, and then your blood pressure goes up. They converted that, and now it's made in a tablet, and it's awesome. And you don't have to take much. You literally take one in the morning, one in the afternoon, and your electrolytes, boom, solid across the board. And I tell you what, most people don't, like, when they're fasting and stuff like that, they don't fail because they have hunger issues. They fail because they have electrolyte imbalances. Mm-hmm. Yeah. So it's real important. So that's just a simple way. So I don't know. I might probably over answered that question right there, but if you notice.
Okay. Easy Mag, did you say? Like easy, just.
E-Mag, yeah.
E-Mag.
It's a real simple, real easy way to balance your electrolytes. Absolutely fantastic.
Okay, awesome. Well, I'll put the link in for what I can, guys. Otherwise, you can reach out to Balanced Health Studios to get anything else that you need shipped out to you. Because people can work with you all over the country, right? They don't need to be in Seagrove Beach.
Yeah, 100%. So just like we're doing now, so literally we can do, a virtual consult anywhere. We can order labs if need be. So, it's a big part of my schedule at this point, where we're sitting down with consults just like this, which I really, that's one of the good things I think that has come from COVID, is that to, connect with people on a whole different level, which is awesome. And I've actually really enjoyed this part of it. I always thought I really enjoyed it just in the office, doing the consults. And now doing it this way is, it almost takes to another level, because a lot of people, I think, are more comfortable just being able to be in their home. It's just a different environment. There's less white coat syndrome. There's less nervousness, and there's it's a little bit more real and raw, which has been nice. Yeah,
awesome. All right, next question. What do you recommend for hydration?
Well, we just hit it. So hydration, of course, water is our primary, right? So that's our primary nutrient for water is, just H2O. And water plays a bigger role than just hydration, because I'll see now I see some things on like Facebook and whatnot, and they'll be like, you don't need water. I'm like, but water plays a bigger role than just hydration. Like it filters the body, it cleans us out, it keeps things moving. So our lymphatics, for example, either you got to move your body or you got to drink water. Other than that, they don't flush. So I love water. We got to make sure our water gets cleaner and cleaner. The majority of the water has way too many halogens in it. Things like fluoride and chloride, which are awful for us, to beat up the thyroid gland. So water, with what we just talked about, like the electrolytes, making sure you're getting sodium, potassium, chloride, and magnesium, making sure you're getting all those electrolytes. That's the name of the game. And I say that because if you came to my office, I have a water machine thing, like a water fountain, but it's reverse osmosis, which is not necessarily awesome for hydration. because it's stripped, everything's gone. So I need to make sure I put that back into my body. And we make that decision because the water down here is not of a high quality, and getting those things out, especially fluoride and chloride, which they beat the thyroid gland down. So in my clinic, with as much water I drink there, I try to keep all the chemicals out, and I just add back in the nutrients. So love water. And we use another product that is our people absolutely love it. You remember, man, it might even been a year that we had our
Anya.
Yeah. Good on you. Our good friend Chris out in San Diego, she makes a product called Hydrate. And I'm telling you, it's just awesome. It's an organic product. There's no sugar added. It literally tastes like lemonade. Our people absolutely love it. We love it. I use it every week, so I don't know if
I'll put the link in the chat.
Yeah, and she does amazing. She really gave us a lot of our we can do this type of attitude when it comes to opening up our place called our Prima, our cafe. She's the only I know in the country that literally had everything was spot on. Like they didn't miss a thing. There was no, they didn't cut any corners, and seeing the way that they did it made us think, well, if they can do it, we can do it. So
I love that.
That's my friend out there, Chris, and she's got a phenomenal product called Hydrate. Other than that Easy Mag I just spoke to, I'm not a huge fan. I rarely can come across a electrolyte drink that doesn't have some kind of added sugar. And we just need to avoid sugar the best that we can.
Yeah, awesome. Cool. As I said, I put that link to go on here if you guys want to get some of that. All right. Why do my thyroid labs fluctuate so much? Next question.
This is a good question, and this obviously comes from someone who has taken their labs several times. So the thyroid hormones, almost like I was just saying a moment ago, this is a great question, and we can take this in a couple of different directions about the thyroid. Thyroids work on demand. And so in demand means two things: what's being demanded of them, meaning how much pressure is being put on them, and what do they need to do. So there's two things. So they could have a lot of demand on them or pressure put on them through toxins that we put into our body, or other organs are requiring them to do things. Like the thyroid is always responding to other parts of the body. So there's a couple of reasons for this. Most likely this individual, there's a couple of reasons for this. One, the most common thing that changes and it varies a decent amount is something called TSH. That's your thyroid stimulating hormone. That hormone, and there's a reason that they tell you, if you're going to go get blood work, don't take your medication that morning because it can alter it. So it does, it does change a fair amount. As simple as this, Karen, your thyroid stimulating hormone will change relative to the temperature outside more seasonally. So if it's cold out for 2-3 weeks straight, there's a chance that your TSH is going to go up, because it's going to need to stimulate to create more thyroid hormones. Your thyroid hormones are a big part of your body's metabolism, including regulating body temperature. So people that have a low functioning thyroid, classic cold feet, cold hands and feet, literally those are that gotta wear their socks to bed.
Yeah.
That's the low functioning thyroid. Yeah. So some people, you just raise your hand.
Yeah, my hands and feet are always pretty cold. Yeah.
That's classic for low function thyroid. But during the summertime, your TSH might balance back out. And I know this sounds odd, but it'll lower down, which means better functioning. Too high means you're too low function. So that's one of the reasons. But there's a lot of things when we look at the thyroid. I'm okay, quite frankly, if it fluctuates.
But by how much? What are we looking at?
0.5, 1.0 max.
Okay. That's kind of a more natural fluctuation. If it's getting more than that, then something's might be.
So for those of you who have your labs out there, your TSH, I typically like it between 0.5 and super high function, rock star type thyroid, 1.5. But if I go up to 2 or 2.5, I'm not calling that hypothyroid yet, but it makes me definitely pay attention to everything that's going on. And that's why it is so important that when we do a thyroid panel, we have to have all the details.
Yeah.
And it's important that I say this too, that thyroid is rarely, Karen, the primary cause. It's rarely the cause, like it is rarely a standalone problem. There's usually three others, and this we literally could do a whole show on this, but I'll cover these because if we start to look at it, there's some people out there right now, they've been on thyroid medications and they can't tell if they're on or off.
Yeah.
They
don't feel any better.
No, and that's a classic case of the thyroid is not the primary. And so there's three others, and I'll go through these kind of quick. It's liver, ovaries, and it could be testes for guys, and adrenal glands. So the liver is real important. So if you have thyroid hormones that your body's making, something called T4, if you have those in the liver, your body converts them from T4 to T3. Really, technically, they're converted by your bile picking off one of those, the 4 and the 3, those are iodines. They're talking about iodine. And the bile that's made in the gallbladder. So that's really, as much as I say liver, this is really a gallbladder issue. The liver and the gallbladder, the bile that we use from there will pick off that iodine and make it an active form of thyroid hormone, what we call T3. That's your free T3. That's the one that ultimately is going to make you feel good. So if all you do, if you only have your numbers of TSH and T4, that's not enough. But if you have high T4 and T3 is really low, we now know, hey, listen, yes, it's affecting your thyroid, but this is a liver issue. We've got to get your liver, your gallbladder, which then, Karen, and we just spoke briefly before the show, man, think of how many people don't even have a gallbladder.
So many. And for so long, we were saying, I have a number of friends that got them out had their gallbladder removed in their 20s.
Yeah. And then they end up with a thyroid condition. And if you're a woman, you end up with hypothyroidism, probably 80% of the time, at least 50% of the time, probably higher, closer to 80% of the time, you end up developing a condition called Hashimoto's, which is an autoimmune condition. Yeah. And then just pumping in the thyroid medications, I'm not saying it's the wrong thing, but it's not the complete thing, where you'll never really experience what the functioning thyroid hormone does for you because all this other stuff is going on. So, and my experience right now tells me that they're not connecting the dots here. If you go in and you have a history of no gallbladder and you also go in and you have low or what we call high TSH, they're not connecting. Hey, listen, you don't have a gallbladder. You can't convert T4 to T3. So therefore your body keeps producing it because you can't convert it. So it is a time. If you've got a thyroid issue, one, you need a full panel. There's usually about 9 markers I would really like to see on that, including vitamin D. That's an important part of it. So that's number one is the liver, Karen. That could be a part of the fluctuation of hormones or just thyroid in general. Adrenals, no doubt about it. If you are constantly demanding, so what happens is the more you have adrenal stress, the more influence they're going to have. They're kind of like knocking on the door of the thyroid. Hey, we need help. We need to speed things up. We need to go. That stress over time downregulates the liver. And most of the time when it's stress-induced thyroid dysfunction, that's where the Hashimoto's comes in.
Okay.
So how do we see that? We see that after a divorce. We see that after a surgery. We see that after a trauma in life. Those are the ones that when that thyroid gets all dysfunctional, we look and we're like, wow, there was an initial sensitizing moment. Like if there was a moment and boom, that autoimmune condition starts. Real quick side note here. Anyone who's listening, if you've been diagnosed with Hashimoto's before, there's something that is like the cream of the crop that's really supportive in helping this. And it's what's called a PMG, a protomorphogen. And it's called thyrotrophin PMG. I'm really getting side-railed here, but I want to talk. You have
thyrotrophin PMG. Okay.
Explain how this works. If you have an autoimmune condition for your thyroid, no matter how much you balance those hormones, it won't matter until you do something about the antibodies. And since we learned all about antibodies this year, what does that mean? Your body develops antibodies against the bad guys, in theory. When it's an autoimmune condition, your body develops antibodies against your own tissues. And in this scenario, in Hashimoto's, it's against your thyroid gland. So what this PMG, this thyrotrophin PMG, just take 2 before you go to bed. If you have Hashimoto's, take 2 before bed, empty stomach. Now, those antibodies will target that protomorphogen. They'll go to your stomach. All those antibodies release. They think it's your thyroid. So it distracts it from beating up your thyroid as you're doing all the other things to heal it up. You're getting your garlic, you're getting your selenium, you're getting, all the good nutrients you need you're getting iodine, all the things that you need for your thyroid. All that's happening, and you're distracting the antibodies. And then all of a sudden, your body will start to reduce the amount of antibodies available. And we just keep taking that protomorphogen. So that's, if you have Hashimoto's, figure out how to get yourself some of that protomorphogen. It's a game changer. And then, so that was it. And then the last thing that is often involved is ovaries. So what happens with the ovaries, if you have an irregular cycle, if you have heavy bleeding, if you have a lot of PMS, those are all signs of excess estrogen. And just like we see classic cases of postpartum, when we have, women who've had babies and then afterwards a thyroid tests. And that shows us that too much estrogen will downregulate thyroid hormones. And really what it doesn't let the thyroid hormone activate, making that T4. So high estrogen will do it, poor liver will do it, stress will do it. So that's why just treating the thyroid by itself can really create fluctuations, because you're not dealing with the other 3 things.
Yeah, which is, I feel like so many people I know, it's just so common to have thyroid issues, and a lot of practitioners don't look at these other things. I've definitely had people look at my thyroid who have never mentioned any of these things. So I think it's a good conversation to have for sure. And people can be more aware at least, and ask their practitioner or come and make a consultation with you, or get more info to be able to actually get to the root cause, get to the bottom of what's been going on.
Yeah, and that brings up another conversation / topic. Again, just a little side note here. So a great friend of mine / client today, she's another doctor as well. And this is like the initial conversation about like drawing a line in your sand and making sure that you have a line in the sand, you can stand for yourself, and really not to ever get bullied. So they go to their other doctor, and they did all this lab work. And when the doctor went over, she goes, they went way too fast, and she doesn't understand it.
Yeah. And
so she can't ask questions. So I'm telling everyone out there that listen right now that we work for you, and your health is an important thing that you have in your life. And if you're going to spend the time, you're going to spend the money to go out and get a doctor and get lab results, know what they are. Like, you can ask more questions. Like, I appreciate it. And it humbles me sometimes too, that, man, I just said that and they couldn't understand it.
Yeah.
But I will tell you, most of us as practitioners, all we want is for our people to get results. So don't feel bad asking your practitioner. And if it feels awkward, remember, that should be you should have a personal relationship with your doctor. And if you don't, bye-bye. Like, go hire another one. Like, so, so that came up today. And again, that is part of almost what I say, like, I don't call it bullying, but it is to some degree if the doctor's talking over the patient's head.
Some are, yeah. Almost bullying or belittling almost. But you are, I love that, because you should ask questions. And you're right. Maybe that's not your doctor. I ask a lot of questions. I have had doctors in the past which you can imagine me asking a lot of questions. But I've had doctors in the past, who maybe don't like that as much, and they're not a doctor that I've used ongoing, because the ones that really will take the time to explain it to me. It's your health. You deserve to feel okay asking questions. I love that. It's just so true. Yeah.
It's a reminder, because my heart felt for it today, because you never want someone to feel like in that position of, like, I don't know, like a weakness, or Or
No, you're going to somebody as the expert. You're not meant to be the expert. Have them explain it to you. If you don't understand something they said, ask, right? You didn't go to medical school. You probably got another profession that they don't understand either, right? Like we've all got our thing. So yeah.
Just a reminder to make sure that you I don't know, sample the buffet. There's a lot of great out there. So make sure you find one that is is intentional about your health as you are. All right. So all right, I just derailed again here. So get me back on track here.
Next question. My 85-year-old mother would like to come off her blood pressure medication under doctor's supervision. What supplements could she take?
Yeah, so of course this is under her doctor's recommendations and supervision. So, and I usually find that this is very doable. Most of the time, and I know this sounds odd, but I'll find some people and I'll ask my patients, they're 85, how long have you been on your blood pressure medication? Oh, 30 years. And have you ever tried coming off? No, so again, I've said it here in the show, the beauty is that the heart is a muscle. And if we understand just the basic mechanics of muscle, we got to make sure it has all the right nutrients. Again, we just talked about Easy Mag. I would say this: if they're on blood pressure medications, making sure their electrolytes are balanced, and which is difficult because it means we have to have a balanced diet. When you're 85 years old, you don't have a balanced diet. You barely eat. That's the reality. So we got to make sure that those electrolytes are there: sodium, potassium, chloride, magnesium. All those guys are there, and so that Easy Mag is phenomenal. There is something that we use called Cataplex B Core. That is so you get a good, strong muscle contraction, which is phenomenal. And then we want to do some of the basics too: sleep right, get rid of the sugar, watch the stimulants. 85 years old, probably not on a ton of stimulants. Karen, probably the best one for overall is something called Cardio Plus. Cardio Plus gives all the nutrients to the heart. We've talked about it in this show before. And one of the beautiful things about it is that it has vitamin G in it. And that vitamin G acts like a vasodilator, very much like magnesium can do that as well. So it opens up those vessels in a nice, gentle, soft way. It doesn't force them open, but it gives the body the ability to contract, so expand. So if they use that often, that blood pressure, then it gets just a little better just by using that product. So Cardio Plus, Easy Mag, and Cataplex B Core will often do a really good job. But of course, do that with your, in conjunction with your doctor. And often what I'll find is people wean off the medications. They'll do less here, less there. And then if they need them, of course, they can go back on. The other part would be to cleanse the body. We see so many people drop their blood pressure by just going through even a 10-day cleanse. I've had people that have been on the 10-day cleanse that stayed on their medications and their blood pressure dropped too low.
Wow.
Because once the medications drove it too low. So those would be the direction I'm moving to.
Yeah. Awesome.
And high five, 85-year-old grandma.
Yeah, totally. That's awesome. All right, next question. My dentist suggested to me a root canal procedure, but I do not have any pain. What would you recommend to take care of the infection under the tooth so I can avoid the procedure?
Yeah, you want to do your homework on root canals. You got to pump the brakes a little bit. They're common, but they're no joke. So we use something for any infection, Karen. We want to support the body to fight the infections. This isn't necessarily medicine to make it go away, but we use something called Conjuplex, and we discuss this often on the program. This is what should be on your home cabinet. And if you have something, like an infection or something like that going on, if you're an adult over 100, 125, 130 pounds, anywhere from 4 to 5, 3 times a day. So we're going to give all the nutrients that the body needs. And I would also, in this one, I'd give the herb that really complements this, and that's Angiographic Complex. The best way clinically to use this, so that's a combination of echinacea, holy basil, and the Angiographic herb, is to, when you put it on your tongue, you put 2 of them at a time, and you about 3 times a day, and hold it on your tongue. Not under your tongue, on your tongue. you'll get this, the echinacea is really, really powerful. And you get this really strong tingling sensation. What's cool there, that's almost a signal that your white blood cells are going to work. And especially for the mouth. Some other things, I think we just talked about this last week, the oil pulling.
Yeah.
Absolutely. That's where you take a tablespoon of coconut oil, like a full tablespoon. You're going to swish it around your mouth. Like you got to chew it first and swish it around your mouth. 10 minutes minimum, ideally closer to 20 minutes, and then spit it out and then brush it out. Phenomenal, getting rid of bacteria. So there's a lot of things like that you can use. If you think that you have a little bit of a candida or a yeast issue underlying there, and you know that because maybe you have some like a white patching on your tongue, get as much garlic into your body as you can on a regular basis. Garlic is just this nice natural defender of the gut, so it'll really help lower that pH, back to a normal level and kill off some of that candida.
Awesome. All right, sounds good. We got some snoring in between my dogs barking. We got it's the dog show, right? Awesome. All right. Next question. I've recently started taking the standard process adrenal tonic for perimenopause. What, if any, positive changes should I recognize in my body? And how long do I need to take the tonic before I see changes? I've noticed I'm sleeping more soundly and curious if that could be because of the tonic, but I've only taken it for a few days so far. Long term, how do I continue to take it? And I'm adding Drenamine to my routine next.
Well, fantastic. Good for you for taking action always. And
yeah, I love it.
Yeah. And listen, if you're getting sleep back, you've got one of the most important, getting one of the most important things you could ask for in your life back. So once we start sleeping again, you start healing, your mind starts working again better, your body heals faster. So everyone listen, never underestimate the power of, the only thing I noticed, I'm sleeping better. Sleeping better will make your entire life better, which is awesome. So here's a couple of things. The cool thing about the adrenal tonic is, yes, you can have an impact immediately. I love that this individual is also using Drenamine. So again, I'll often try to pair herbs with the nutrients. Nutrients feed the body, herbs activate the body. So the Drenamine is what feeds those adrenal glands, and the adrenal tonic, there's 4 herbs in there, Karen. It's ashwagandha, which is immediately going to help regulate the hypothalamus gland. That'll make you sleep better. Like that is like, it calms you, it swings that pendulum so you can get out of sympathetic dominance, like stuck in that like go mode. So if that's the only thing it does for you, beautiful. Ashwagandha, Rumania, of course, is a tonic, meaning it heals the adrenal glands. Licorice root is a tonic. It's antiviral. It helps a little bit of everything. Licorice root makes it taste better too. And then echinacea is in there as well. So that adrenal tonic, it's like the superstar type of tonics. Well, now with that being said, how often do you take it? Well, my honest answer is, as long as you want to be superstar, like you want to be closer to superhuman, take it. And I mean that in all seriousness. This is
you've got it right there.
Because we are pushing ourselves, like absolutely no doubt our immune systems are under attack, our emotional system is under attack, and no doubt our adrenal system's under attack. So would it be safe for me to say that I think everyone would benefit from adrenal and mental and immune support? 100%.
Yeah. Yeah, for sure. And that tonic, everybody can, if they need to get that, they have to call Balance Health Studios, correct?
Correct. Yeah, and I'll tell you how important this is, and especially for a lot of the tribe and community that have been using it. A lot of people who they literally have a bottle at their desk as well. So it's coming out of Australia. I don't know if you know that.
Yeah.
So, and we know there's going to be some supply chain issues in the upcoming. So getting it. So we made a decision to make sure that we have at least a 3 to 4 month supply. That's how it is to our clientele and for our own personal lives. Like there's a couple of things that we used to we normally don't, because it costs a lot of money, to have, to ship over that much supply. So that was one of the ones we literally ordered copious amounts. So Everything goes
For
back.
the reason nobody else can get it right now.
Yeah, I have that problem, but nonetheless, you are going to be healthy. Yeah.
I love it. So good.
The last part was, how do I continue to take it? So
Yeah.
part of this, I really try to get to people after. So if you just started for the first week or so, take it every day. Take you, about a half of what we call it half a shot twice a day. As you go, you're going to find out what works for you. And this is what I'll say with a lot of different herbs that we use. Find out what works for you. Minerals and nutrients are different. You got to feed the body all the time. But when we're using things like ashwagandha, we're using things like, St. John's wort, you can start to navigate these different types of herbs almost on an as needed basis, especially like kava and stuff. So with the adrenal tonic, the more I do, the more I use. And if you allow it to be a tool to help advance you to get closer and closer to being superhuman, that's the goal. That's so you figure out how whatever that works, that means for you.
Yeah, love it. Awesome. All right. Next one. You mentioned a supplement in a previous show to use when overly emotional and crying easily.
Most likely. So if that emotion shows up, like you cry real easy, like you're watching a commercial and there's a little puppy dog on there, and like you're over there and you're like, oh, my allergies. And you, like your eyes are welling up. This is common. This is a dysregulation of the hypothalamus gland, and this happens a lot. This is it's really, really common.
Or a really cute puppy.
Yeah, true. Or really like in the middle of winter, right? So if those are things, and you find yourself very emotional, or listen, it could be crying, or it could be anger, it could be fear, it could be concern, but it's like a little bit different for you. That the very best thing that makes it a really nice quick impact would be something called hypothalamex. Super, super good. But we got to go pretty kind of heavy dose in that, Karen. So I usually, if they come in, one of the ways to help the body function better is use hypothalamex three times a day for like the first 10 days. And the cool thing is often it helps re-regulate. So again, that would be the vitamin nutrient part of it. If you wanted to pair that, I wish we could like quiz everyone right now. So I say, what would be the best pairing for your hypothalamus gland? And the best there is ashwagandha.
Okay.
So if you put those two together, regulating hormones can happen very fast. Regulating emotions. Yeah. There's still work to be done on a hormonal level, but that significantly, and that's the ones where you want to kill everybody.
Yeah, we've got a comment here. Doesn't Min-Trex help with emotions too? Min-Trex,
is that what they said?
Yeah.
Yes.
One of our tribes said, yeah.
Yeah, Min-Trex is phenomenal for that, and that's for very, very same. That's restoring all the minerals that get depleted when you're stressed out.
Yeah.
Chex part of that comes from a product called Chex, and it gets those minerals to cross the blood-brain barrier like that. So it's phenomenal, especially when we know there's an emotional disruption there. So whoever said that, high five.
Yeah, I love it. Awesome. Okay, cool. Next question. Is it normal or okay to not eat when stressed?
Is it normal or okay to not eat when stressed? Yeah, that's okay. Yeah, that's okay. In fact, we never want to eat if we're not hungry. That's the general rule. Yeah, I think I need to throw some like
caveats
here. Yes, meaning that. Now listen, if you don't eat for 24 hours, and I get it, sometimes we'll do that fasting and stuff like that. But if you don't eat for 24 hours, you're going to be nutrient deficient. Your vitamins, your minerals, etc., they're going to be deficient. So if you have someone, a family member, friend, a loved one that is super stressed, maybe if they, went through a hard time, a divorce, a loss of a loved one, a dog, or something like that, and they're not eating because they're stressed, which is not a problem I have. If they are not eating because they're stressed, yes, at that time it would be beneficial to help them eat something. but this is still a scenario to eat something that's healthy for them, not destructive for the body. So, and this is really important under stress. When you add sugar to stress, you add sweets to stress, you're digging a little bit of a deeper grave for that individual. You're creating a bigger imbalance. Remember that sugars deplete more nutrients, et cetera. So be very mindful and be very, and be loving at the same time, but get them to eat things that are good for them. But to not eat under stress, for a lot of people that works. There are some other challenges here. If this is continuous, so we're acting right there. If let's say there's a one night thing, a one day thing, but what if this is, I don't know, again, I don't know why I keep using divorce as the example, but divorce or someone in your family is chronically ill, and you're just, it's stressing.
Something really stressful.
Yeah, like the stress doesn't go away, or maybe you have an injury in your body or something. There's just stress nonstop. The challenge about night eating is that because people will say, well, then what do these people do for energy? How are they surviving without food? They produce cortisol, which is a stress hormone. That stress hormone goes to the liver, knocks on the door and says, hey, we need energy. And the liver goes, I got you covered. I'll release some glycogen, which converts to sugar. Essentially, you're releasing sugar stored up in the liver. So even though you're not eating any food, you're releasing sugar into the body. So it keeps you kind of in that rush, the stress rush. The challenge here is that when the liver gets depleted, then it goes to the muscle. And the muscle then starts to leach out all of the glycogen or the sugar that's kind of stored. The glycogen is really what it is, up in the muscle. And your body literally starts to burn up its own stuff. So that's how we become skinny fat. Where like they're literally, you see people, their muscles are wasting away. You've seen someone go through this, long breakup or something like that, and they look like a fraction of the person they used to be. And it's because their body, it's almost as if it's eating itself. It's not eating the actual muscle tissue, but it's eating everything around it. So 24-hour window max. And if you know someone that is depleting, try to find a way. And how do we do that? How do you get them? You've got to change it. You got to change up the scene. Stop talking about it. Stop thinking about it. Stop doing it. And you got to go do something different. Go be present in something else. Get them active. Go bring them to lunch. Go exercise. Go take a walk on the beach. Go ride a bike. Something's got to interrupt that pattern. And then in those same people, there's one other situation here, Karen, that under long stress, that person may no longer be in that stress. They might be over it. And in this scenario, it goes back to the conversation we just had about the hypothalamus. Sometimes that gland, that hypothalamus gland, gets bombarded for so long, so bad, that it dysregulates. So the hypothalamus gland regulates body temperature, hot, cold. That's what people that, like I told you about, even the cold feet and cold hands, all that. You need a sweater when you go into a store because it's always so cold. That's hypothalamus regulation. Body temperature, emotions, and also appetite. So it also includes the body's ability to lose weight. So if the appetite is just not there, but that stressor is gone, you need to re-regulate the hypothalamus gland.
Yeah. Okay. Cool. Next question. Let's go to the next one. Should I always take a probiotic?
You always take a probiotic. Not necessarily. And I think this is one that might be a little overused. I love probiotics. We carry several different types. They're often part of something I'll give to someone as they're reestablishing their health. But when it comes to our gut, I'll try to make this quick and simple here. We need to kill off whatever's bad in there. We need to clean it out, and then we need to regrow it. So kill, clean, grow. So we might kill it off with garlic. We might clean it out with Spanish black radish, and then we grow it with a probiotic. Like that right there, rock solid. Yeah. So that probiotic, now I want you to picture the garden in the back of your house, right? You killed off all the weeds, you raked it all out, and now you plant seeds. Once you planted them well and you nurtured them, now you give them the right foods, right vitamins, minerals, and stuff like that. You don't need to plant seeds all the time because your seeds in there. That's in theory, that's the idea of how it really, really should be. My favorite is, most of the people that come to me will know that I typically have you on a probiotic for about 30 days, or really one bottle of whatever you're going through, and then I have you coming off, and then ideally you're eating foods that have probiotics, things like sauerkraut and kimchi and kombucha and stuff like that, because they still are better in terms of how broad they are, I do like the probiotics. If your gut has been beat up for years and years, I do like the probiotics. We carry one that is a pre and a probiotic. Sometimes I'll keep you on that a little bit longer, so we're nurturing that soil a little bit more. But
is that a simple process one?
Yeah, it's called Pro Synbiotic. So it's like, yeah, it has a pro and a prebiotic in there.
Okay. Okay. All right. What do we have next? Can anti-nutrients in grains and beans create vitamin or mineral deficiencies?
Can anti-nutrients in grains and what?
Beans, grains or beans.
Yeah. Those are called phytates. Yes. The answer is yes. Yes, they can absolutely cause nutrient deficiencies. And this is probably underestimated. A lot of times people will, if I talk to them about nutrition, they're always telling me what they're eating, but rarely talk about what we're not eating. So for example, what we just talked about there, like, probiotic type foods like sauerkraut and kimchi or bitters and stuff like that. I'll hear people like, well, I ate some salad last week and I ate, good grass-fed meat and stuff like that. But these other foods that we are eating, things like grains and stuff like that, they block the nutrients. They block things like calcium and copper and iron and magnesium. Significant. So, in those and a lot of the grains, when you think about how many different things we eat with grains and beans and all that kind of stuff, these phytates will literally block these nutrients. And when, some people will eat beans 3, 4, 5 days a week, and they have anti-nutrient properties. So sometimes that's where it gets confusing. So that individual's eating really good, but in that eating really good, they're eating foods that are blocking other nutrients. So it is important that we're mindful of those. Just in general, because we're not going to, just in general, like we've always talked about it here, grains, we're going to leave most of them out, especially anything with gluten in it. Literally, it just wreaks havoc on your overall, vitality. So the quick answer to that is yes, they can.
What about beans? Leave those out?
So beans there's an opportunity here for us to have beans, but ideally, Karen, is when we soak them, we break down that protein, that protein shell, and then it releases away some of those things that are really hard for your body to break down, so they're not as bad. Yeah, we I know a lot of people are soaking their beans. It can be beneficial, and I would tell you, I think the bean is still part of a wonderful food for human beings. Most of us can't handle them though.
Yeah.
So, I would probably say, have beans once or twice a week, and really be mindful of like how you feel the following day. Like, are you getting bloated at all? Your bowels still moving okay? Getting any brain fog, that kind of stuff. So, if the answer is no, awesome. Then you're probably just fine. But pay attention, because often those are things that are taking place, even though I just went out and I had a healthy burrito or something like that.
Yeah. Awesome. And that's a bit the same with everything. There can be lots of like healthy foods that might not work for you. Like the more you can pay attention to how foods do interact with your body or how you feel after eating stuff, the more you're going to be able to find out what works for you, right?
Yeah, 100%. That awareness of really literally knowing our body, because God's garden is still my primary diet for everyone. Yet today I was having, I had this guy and he asked me about every diet they're out there. What do you think of Atkins? What do you think carnivore? What do you think about vegetarian? What do you think out there? So like there's a fit for everyone for somebody.
Yeah.
I think the doctor we had here, you did the plant-based diet there.
Dundry?
Yeah, Dundry. So all those questions, again, there's a fit for every one of those. But it's really more about us, the host. Like, what does our body need? And those are things sometimes that we have to navigate. That's where you really want to get with, your healthcare provider, your coach, to kind of see what fits for you. Because carnivore diet might work for someone for specific reasons, because they have too much candida or yeast or something. But you give that carnivore diet to someone else who doesn't have enough digestive enzymes or poor working gallbladder, good luck, right? So everyone's a little bit different.
Yeah, for sure. Awesome. All right. We are running out of time. We've got time for one more quick question. I don't know if any of them are quick, but anyway, are acid reflux drugs safe to take for long periods of time? Is there a better option for someone diagnosed with acidic erosion on their teeth during sleep?
First part of that question, are acid reflux medications safe for the long haul?
Safe for a long time. Yeah.
not. And I think it's always, we kind of refer to the drug and the symptoms and the precautions and stuff and side effects, but almost everyone I've read, that literally most of them aren't supposed to go past 2 weeks. And I know people use them past that, and it's a standard process. I mean, like a standard procedure, yet it has its downside. Most of those will inhibit the ability to make good, strong acid. The second part of this question, if I heard it correctly there, was the erosion that's taking place during sleep on the teeth because of, is that right? Because of the acid or the reflux?
Yeah, it says just diagnosed with acidic erosion on teeth during sleep.
Okay. Well, it's not really a diagnosis. That's a description. And that's one of the problems that happens in our system. That's just a description. It's like arthritis. You got inflammation of a joint. Thank you. Yeah. Now what? So really that's a description of what's taking place. I'll tell you what most likely has happened there. We talked last week about cavities.
Yes.
Really what happens in cavities, it starts with a pH imbalance, erosion of the enamel on our color, the color of our teeth changing, all of that kind of stuff. It's a pH imbalance first. The mouth becomes too alkaline. That happens when our stomach acids get weak. Typically, it'll coincide with a little candida or yeast. So we're getting this fungal growth taking place, this bacteria that's building up in the body. That inhibits absorption of minerals. This is where the problem is. That's what erodes the enamel. You don't get the absorption of minerals. Now, the bummer is that antacid, this person is also on an antacid or some kind of, indigest. One of the things they block out are minerals. So this is a very, very vicious slope. Like, man, there's not a good ending to this because they can't break down they don't have the right acid in their gut to break down the foods, to get the right vitamins and nutrients, things like iron and copper and magnesium and zinc and all these trace minerals. They're not getting them now. They're unfortunately, their body just becomes very efficient at breaking down carbs and sugar. So how do we flip it all over, clean it out? Got to get the body clean. So, probably a conversation that you want to have with a practitioner, and dive a little bit deeper, but I'd say you can absolutely positively can fix this up. You can get off that. Most likely you can get off the medication by helping your body get a little bit stronger by actually increasing the acid. I know that sounds crazy. Increasing the acid in your gut so it becomes stronger, balance the pH, kill off that candida and yeast, and it'll change the entire, literally environment in the mouth.
Yeah. We've got a comment here. My mama slowly came off her antacid medication by taking apple cider vinegar every day. I was so proud of her. We're proud of her too. Hey, that's awesome.
Yeah, love it, love it, love it. Action takers. That's the name of the game. Take some action. When you have your line in your sand and be like, I'm just going to do something next, and that's beautiful.
Yeah, I love it. Awesome. Well, that leads us into our last question, talking about action. What is our one action that our listeners can take from this show to move them towards their goal of becoming superhuman?
And I think I have no idea that I think we talked about. It was the comment I made earlier, and it's draw your line in the sand. Don't get bullied. And I don't mean you have to be a bully back. I just mean draw the sand. Know where you stand, and that gives you confidence. It takes the angst away from everything. Just know, hey, if this happens, if I do this, if I gain 1 more pound, I'm going on a 20-day, fast or something, whatever it may be. And I'm talking about the pound. I'm really talking about some other stuff that's taking place there, but no. And I think you'll find comfort knowing that there's a lot of other people that are looking for other people that are holding their ground and being strong. So this is the time, this is the place for each one of us to continue to get stronger, to keep leveling up, physically, mentally, spiritually, all the above. So that's it right there. Draw your line in the sand and do not get bullied.
I love it. Awesome. Well, thank you so much, everyone, for tuning in. We'll be back same time, same place next week for another episode of the Health Made Simple show.
Love and appreciate all you guys. Keep doing your thing as usual. We're going to take deliberate action for your mind, your body, overall wellness. Y'all be awesome.